All right, so then you get into the 5-minute neuro types of things. The upper cervical dermatomes like C1, 2, 3, 4, those are going to be pretty much surrounding the head and the neck. And clinically, they don't really come up that significantly. The big ones are when you start getting into C5 to T1, T2. Okay? These diagrams here are out of a text called Hoppenfeld. There's two books. There's one that's examination of the whole body, and then there's one that's just, well, when I say whole body, it's just mostly orthopedics and joints. And then the other one is focused on neurology, so it's going to show each level, talk about where the dermatomes is, the reflex if they apply, and then actually the motor, the myotome, the dermatome, and the reflex. Okay, so then you want to make sure that you know all these different cervical dermatomes. And there's different charts and books that will have slight variations. So this is the way it is out of the text. This is another dermatome chart. This one's on the secure site. So a lot of times you're going to say C5 is going to be the shoulder area here. A good way to remember C6 is like this, right? C6, also with the hand like that. So C6 is going to be wrist extension, and then C7 is like that. It's going to be elbow extension, wrist flexion. So I'm mixing together dermatomes and myotomes, right? C7 is going to be here. C8 is going to be here for dermatomes. T1 like this. T2 up into here. There's going to be some slight variations, but on this one here, it has all these little different dots that say if you wanted to specifically touch one area to get that dermatome, that's what all these dots are, and then it has them listed here. Okay. So, and like this shows there are variations from one person to another. But basically what you're doing is when you're going through and you're testing dermatomes, you're using a pinwheel, you're checking one side compared to the other. And so you map out on that patient where the difference in the sensation is. And then maybe you can later find out which level that is. But you just want to map out the area on the patient when you're doing the exam where their decreased sensation is or increased sensation. But in terms of the dermatome things, you need to know, because basically when you're doing the practical exam, you're going to need to say, we'll say, okay, show me the dermatomes from C5 to T1. And you need to say, okay, this is this, and so on and so forth all the way through. And then the same thing with the myotomes. So, we've got the myotomes listed in here. The dermatomes on here, you can write a description in here, or however you want to make sure that you know it. But you're going to need to know that for quizzes, for midterms, and actually for when you're in practice. Okay? So then myotomes, C1, C2 is flexion of the neck. And C3 is going to be lateral flexion. C4 is shoulder elevation. C5 shoulder abduction. C6, again, if you remember it like this, elbow flexion, wrist extension, C6. C7, wrist flexion, finger extension, elbow extension. Okay. C8 is thumb extension or ulnar deviation. Go this way. Okay. What's commonly done though is finger extension too. Oh wait, no, finger flexion. So C8 is like this. You have them try to hold the fingers together like that. And then the intrinsics of the hand, you can have them hold their fingers apart like that, or you can put a piece of paper in and say try to hold that and pull it out. Okay. You don't have to do each one of these for a myotome, you just have to know at least one thing for a myotome. And the jaw reflex, we're not really going to get into doing that in here. I mean, it's in the text. Basically, you're tapping on here. Okay, and then the brachioradialis is going to be right here. You can tap on this part here, or you can hit into the belly of the muscle. And then the biceps is going to be here. We'll demonstrate that. Actually, does somebody have a reflex hammer? I forgot to bring it. Can I borrow it, please? So a lot of times there's a way that you can do these reflexes without having, whenever you're examining the patient, you want to do things in an organized manner so that you're going to be time management. Okay? If you hold the patient like this, I can do all the reflexes from this position here. Okay? Turn this. Okay, I'll do it one and then I'll turn over here. So now I've got my thumb on the biceps tendon, and then I'm tapping on my thumb here. There's brachioradialis, there's triceps. Okay? We'll do that again, turn over here. So my thumb's on the biceps tendon, here's C5, C6, C7. If you're having trouble getting C7, sometimes you can bring it in this position here and go like that. Okay? So then this, again, these are the charts, and it talks about C5. It shows the different dermatome-myotome reflex. You need to know those. And then in the notes here where it has in parentheses like brachioradialis is typically considered C6, but you may see some sources where it says C5. Biceps is usually C5. Some sources may say that it's C6. Triceps is pretty much always uniformly going to be considered C7. So there's the reflexes. And then there's just a whole different list of things with palpation. Okay, the EOP, that should be one of the things on here. Yeah, so that's written in already. External occipital protuberance. What's SPs and TPs? Spinous process, transverse process. So you can palpate those. Which one of the cervical vertebrae does not have a spinous process? Yeah. Atlas. So that's why when you're palpating down from the EOP, the first spinous process you're going to feel is going to be C2. You're not really going to feel this back part of the atlas.
The picture of that.
It's the arch, but see how you can see that these all stick out farther, and then that atlas is dipped in. I mean, that's just a one-dimensional picture. Obviously, if you can see from here, it's just a complete arch. Then a lot of times, you're going to have lymph nodes in this area here. So if somebody has an acute infection, upper respiratory infection, they may have enlarged lymph nodes. You can palpate the carotid arteries, the pulse there. Obviously, that's something that you don't want to put a needle into. Right? Mandible and the TMJ, the hyoid bone. Basically, if you look at the thing here, part where this indent's here, that's going to be where the hyoid bone, because a lot of the muscles anchor onto that. So the hyoid bone's up here, and then you can feel the other parts of the bone as it goes back. Then you have the thyroid cartilage or the Adam's apple. And paranasal sinuses, obviously you're not going to palpate the actual sinuses themselves, but the bone overlying them. So, if somebody may have, if they have a sinus infection, they may be tender here, may even be inflamed or hot to the touch. The supraclavicular fossa, then the scalenes, again, you can feel those when you breathe in. Those are going to be going down under the clavicle, attaching to the ribs. Then the pec minor, cervical rib, you may or may not necessarily be able to palpate that, but you can feel in that area if you feel something bony up in here in the supraclavicular fossa. The upper trap, a lot of times there's trigger points in that area here. Then the suboccipital muscles, the SCM, everybody knows what that stands for, right? Sternocleidomastoid.